Hi, my name is Chelsea Grandstrain, and I'm going to talk to you about fetal macrosomia. You may not know what fetal macrosomia is unless you've been pregnant before and have gone through a normal pregnancy or a high-risk pregnancy. So let's get into it. What is fetal macrosomia? This is termed large for gestational age. This is when the baby is delivered and is weighing over 4,000 grams or 8 pounds 13 ounces. The height, weight, and head circumference are all put into percentiles. If the baby is 10% or smaller, that means that the baby is too small. And if the baby is 90th percentile and above, then that means that the baby is too big and considered macrosomic. According to the American Academy of Pediatrics, about a little over 10% of all pregnancies are considered macrosomic. So how do we diagnose fetal macrosomia? So this would be done by ultrasounds that are taken throughout pregnancy. Usually there are about 2 to 3 ultrasounds during pregnancy, and this can determine the health of the baby as well as the estimated height and weight. Usually height and weight isn't determined until after the baby is born for accuracy. So what are the causes of fetal macrosomia? So first cause could be genetics. So if either one of the parents are tall or larger, then this can affect the baby's height and weight as well. Pregnancy weight gain. So if the mother gains a significant amount of weight during pregnancy, then this can affect the baby's weight as well. Prolonged pregnancy. Typically, pregnancy is about 40 weeks gestational age. And if the baby is still in utero past 40 weeks, the baby doesn't stop growing. So this can cause the baby to become macrosomic unless the baby is induced. And then the most common cause of fetal macrosomia is diabetes. So if the mother consumes an increased amount of sugar, this goes to the baby through the circulatory system, and then the baby makes too much insulin, and because of too much insulin being made by the baby, the sugar is then stored as fat, and then the baby grows larger than it's supposed to at that gestational age. Some consequences of fetal macrosomia are injury to the newborn. So the baby can get shoulder dystocia, where the shoulder gets caught in the birth canal during delivery. This can cause nerve damage and oxygen deprivation. There can be longer delivery times, difficult delivery due to size of baby. The baby can get caught in the birth canal, and this usually leads to cesarean section or a C-section. So C-sections are more common in macrosomic pregnancies. The baby can become jaundice and also can have glucose irregulation. So low blood sugar after delivery increases development of birth defects and respiratory distress. So what you want to do is prevent macrosomia. So how can we prevent macrosomia? Most importantly, go to your OB appointments. Throughout pregnancy, you have multiple OB appointments. They do lab tests, ultrasounds. They want to determine the health of the baby and estimated height and weight. Also check you for gestational diabetes. So making sure that you're going to all of your appointments can definitely help prevent that. If you do have diabetes, make sure you are checking regularly your blood sugar, and if you need insulin, make sure you take that when needed. Eating a balanced diet, getting your fruits, vegetables, grains, proteins in, and also eating less sugar. And also, lastly, getting exercise in as much as you can handle. Thank you for watching.